Oh hey, it's Matt. It's time for part 2 of my journey through the healthcare system. So if you remember from part 1, I tried the traditional healthcare system to find a doctor who would sort of just become my primary care physician. It would just become the doctor that I used as I got older. He would understand my situation, understand my health, understand my maladies, and I would just grow to love him. Well, the first guy I went to, he didn't want anything to do with that. Then I found out about direct primary care. Now, I got super excited about direct primary care, and for a while it was going really well. So for those of you who don't know what direct primary care is and how they advertise it is, it's like Netflix for your health. What that means is there's a monthly subscription fee that you pay to a doctor's office. So there's no co-pays when you go into the doctor. There's none of that. You get unfettered access to this doctor. You can text them, you can video call them, you can email them, you can just go into their office whenever you want, and they get to know your health. So I love this model because in this model, they make more money the more patients they have. And if they have more patients, then they want you to be healthy. They don't have time to sit there with all their sick patients. They're going to want to get you healthy so they can have more subscriptions in their service. So I found a doctor. He was my age. He was super nice. He took 90 minutes on our initial appointment to get to know my entire health history. He wanted to know my psychological background, any prescriptions I'd ever taken. He even ran some blood work. And I thought, now this is what I wanted. This is exactly it. Then I came to him with some skin issues. If you can't tell, I got a little bit of redness on my face, and it comes up every now and then when I get stressed out. This guy immediately wanted to put me on facial antibiotics. He wanted me to take an oral antibiotic, and then he wanted me to take a topical one. And I'm like, dude, I think it's just might be a food allergy or something that I'm taking. He goes, oh, no. What you need is you need these antibiotics, or you even need Accutane. That's what he tried to put me on, was Accutane. Do you know what one of the side effects of Accutane is? It's suicide. Suicide? For some redness on my face? No. Then I even mentioned that sometimes I get acne on my back if I work out too much, and he goes, oh yeah, that happens to me too. I just kind of don't work out as much, and that's my fix for that. Are you advocating that I don't work out as much and I take a medication for my face that makes me want to kill myself, possibly? This still doesn't sound like somebody who cares about my health. So after he kept trying to shove antibiotics down my face, he tried to do Accutane, he tried to tell me just don't work out as much and then you won't have back acne. I said, no, I'm out of here. This isn't going to work for me. And I continued my quest on because once again, this person didn't actually care about my health. They just wanted to write a prescription and get me on my way.